Hi, my name is Pelumi Olawale. I'm a counselor and psychologist with HelloSelf. I work with individuals who present with mild to severe mental health difficulties, helping them to learn and develop coping strategies to manage these difficulties. To be an eating disorder specialist means that you have spent a considerable amount of time studying and working within the field of eating disorders. You would also have specific knowledge about what causes eating disorders, as well as the symptoms to look out for and how best to treat the illness. An eating disorder specialist would understand how nutrition affects your body, including recognizing how eating disorders causes nutrition issues and physical problems. First of all, it is important to understand that an eating disorder is not just one presentation. There are actually 7 different types of eating disorders. However, the NICE guidelines only caters for 4 of them: anorexia nervosa, bulimia nervosa, binge eating disorders, and otherwise specified feeding or eating disorders. The NICE guidelines suggest cognitive behavioral therapy-based interventions for eating disorders. So CBTE, also known as Cognitive Behavioral Therapy Enhanced, is based on a transdiagnostic model for eating disorders. The aim is to identify processes that are operating in the individual patient, thus creating a tailor-made treatment that fits the patient's psychopathology. It's emphasized that it is better to do a few essential aspects well in changing behavior rather than tackling many things suboptimally. Second, it is based on the idea that people learn by doing. Normalizing the eating pattern and regaining weight are key features from the start of treatment. CBT-informed group programs have also been recommended for bulimia and binge eating presentations. The aim of these treatments is to help individuals to be better at noticing their treatment behaviors and change negative beliefs about their bodies. Sessions also involve addressing the emotional triggers for eating using cognitive restructuring, behavioral experiments, and exposure interventions. CBTE has 4 stages. In stage 1, the focus is on gaining a mutual understanding of your difficulties with food and eating. Typically, a therapist will ask you to complete several questionnaires and a self-monitoring diary. The purpose of this is to help you and your therapist to figure out what kinds of problems you face and the extent of your difficulties. Early on in treatment, you will set out your goals. The advantage of having goals is that it will allow you to evaluate your progress throughout therapy. Finally, an essential part of stage 1 is to work on establishing regular, healthy eating patterns. You'll be asked to keep a record of your eating habits and feelings and work towards eating regularly throughout the day. In stage 2, you will review your progress and develop a plan for the rest of your therapy, including the skills that you might want to learn. Of course, you will be able to modify your therapy plan together with your therapist throughout therapy to best suit your needs. Stage 3 will focus on the processes that might maintain your difficulties with food and eating. Depending on your individual needs, you might focus on some of the following: addressing concerns about shape and weight, improving your skills to deal with day-to-day events, making sure that other important areas of your life don't get squeezed out by the focus on food, addressing extreme dietary restraints, addressing low self-esteem, perfectionism, or interpersonal problems if these are getting in the way of getting over your eating problem. In stage 4, you will think about the changes you have made and how to keep well in the future, including how to deal with any setbacks. With the help of your therapist, you will produce a plan to help minimize the likelihood of relapse. CBT is educative. It aims to teach the patients to be their own therapist and emphasizes relapse prevention. Teaching the patient to understand the process, how their thoughts influence emotions and behavior, how to identify and evaluate their thoughts and beliefs, and plan for behavioral changes is an essential part of CBT. CBT teaches patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. Therapists help patients identify key cognitions and adopt more realistic, rational perspectives. This is achieved through the process of guided discovery by questioning their thoughts to evaluate their thinking. Also, the therapist creates behavioral experiments for the patients to directly test their thinking. CBT uses a variety of techniques to change thinking, mood, and behavior. Behavioral and problem-solving techniques are essential in CBT. The types of techniques the therapist will select will be influenced by the conceptualization of the patient, the problem you are discussing, and your objectives for the session.